So azoospermia means there's no sperm in the ejaculate. And before we did our work on this in the early 90s, it was really basically untreatable. But now we have great news for you, and I'll explain. There are two types of azoospermia. One is caused by obstruction. Like if you've had a vasectomy, that'll cause azoospermia. And your testicle is still making good sperm, but they just can't get out. That's obstructive azoospermia. The other kind of azoospermia is where it looks like your testicle is really making no sperm. But in 60% of those cases where we think your testicle is making no sperm, it is making a tiny amount of sperm. And too tiny to fertilize normally, but a tiny amount. So we can do microsurgery on your testes under local anesthesia, making sure not to damage or hurt your testes. We do that very carefully. And we can retrieve those few sperm that your testicle is making. And we don't need 100 million sperm or 10 million sperm or 10,000 sperm or 1,000 sperm or 200 sperm or 100 sperm. We just need a couple of sperm. And we pick them up, inject them into the egg, and we have a success rate that's no different than if you had a perfectly normal sperm count. Now that's 60% of azoospermia, non-obstructive azoospermia. So we can't guarantee this, but at least 60% of the time we can find enough sperm to give you a normal pregnancy rate. So that's how we handle azoospermia.